Hi, Dr. Katie, right here on HeyDoc with your symptom checker. On these episodes of HeyDoc, we aim to go through symptoms associated with different conditions so that you hear these symptoms from the mouth of a professional. And as always, we would really appreciate you smashing the like button and subscribing. Let's get right into today's symptom checker. Today, we're going to talk about the symptoms associated with type 2 diabetes. Type 2 diabetes is the most prevalent type of diabetes, and in this condition, the blood sugar levels become elevated. We also refer to this sugar as glucose, and glucose is a primary source of energy that we derive from the food that we eat. Insulin, a hormone produced by the pancreas, plays a crucial role in ensuring that the glucose effectively enters into the cells for the energy to be utilized. In type 2 diabetes, there is either an insufficient production of insulin by the body or an inadequate utilization of the insulin that is produced. And as a result, an excessive amount of glucose remains in the bloodstream and a diminished amount reaches the cells for energy utilization. Now, on to the symptoms of type 2 diabetes. The two main symptoms indicative of type 2 diabetes are increased thirst, which is called polydipsia, and so you drink a lot more. And as a result of drinking a lot more, you then have frequent urination, known as polyuria. Those are the two main and early signs of type 2 diabetes. And these two symptoms happen as the body is trying to get rid of the excess glucose through the urine. The other symptoms include unexplained weight loss. This is because despite eating more, the cells of your body are unable to effectively utilize the glucose as their energy source. And as a result, you naturally become more hungry. That is another symptom of type 2 diabetes. Then we have the very vague symptom of feeling tired and fatigued all the time. So if that's you, remember to go to your doctor and get checked out for type 2 diabetes. Type 2 diabetics heal very slowly when they suffer a wound, particularly those on their lower limbs. So if you've noticed that wounds, not just on your legs, but on different parts of your body are very slow to heal, remember, get tested for type 2 diabetes. Gradually developing blurred vision. Now, let's remember that blurred vision can be caused by lots and lots of different pathologies, but it is also a symptom that occurs in type 2 diabetes because the excessive amounts of glucose can deposit and cause damage to the back of the eye, called the retina. Tingling and numbness in your extremities, usually the feet. This is a symptom that happens further down the line. Usually these patients will already know that they have diabetes, and it is a sign the excessive amount of sugar in the bloodstream has started to cause damage to the nerves in the lower limbs. Those with type 2 diabetes may eventually develop what we call as acanthosis niagara. This condition is usually seen when the skin around the neck and in the armpit are thick and dark. Now, acanthosis niagara can be congenital, so some people may be born with this kind of skin in those different areas. It doesn't always mean diabetes. Women with poorly controlled diabetes may have more episode of vaginal thrush or yeast infections, not just in the vagina, but also in the groin, in the armpit. This happens because the yeast that causes thrush or skin fungal infection thrives in not only moist conditions, but in environments where there is a high concentration of glucose, which is what happens in type 2 diabetes. Type 2 diabetics may also be more susceptible to skin infection. That's it for this symptom checker. As always, thank you so much for watching. Do remember the like button, smash it and show us some love. We'll see you in our next video. Take care.